It is now with great honor that I introduce the first of the Harvard Medical School class of 2025 speakers, Kushal Kadakia. Kushal was born and raised in Houston, Texas, right down the street from NASA, which is fitting considering that when we have a problem, we look to Kushal. Kushal and I actually went to Duke University together for our undergraduate education, and us pre-meds there not so jokingly referred to him as the future of medicine, and for good reason. While at Duke, he studied biology and public policy, served as a Truman Scholar, helping to make Duke's campus smoke-free during his tenure, and yes, somehow he still found time to heckle the UNC basketball team with the rest of the Cameron Crazies. Kushal's journey continued as he studied epidemiology and history at Oxford as a Rhodes Scholar, and worked with multiple government agencies, including the Center for Medicare and Medicaid Services, the FDA, and the North Carolina Governor's Office. Now at HMS, unsurprisingly, Kushal has continued to impress. He has been deeply involved in research with a focus on FDA regulation, publishing over 75 articles in those great journals like New England Journal of Medicine and JAMA, has received too many awards to name, so I won't even try to, and was the youngest person to be appointed to the editorial board of the Journal of the American College of Cardiology in History. But most importantly, here at HMS, he's excelled in being just about the most generous and kind friend that any of us could ask for. Well, now you guys know where our imposter syndrome comes from. All right, Kushal, I have just two things to say to you now. First, congratulations, and second, DDMF. Now, Kushal will deliver his remarks entitled, What Medicine Can Be.
Thank you. Thank you, Justin, or should I say Dr. Gelman, for those incredibly kind remarks and also for reminding everyone that our blue is best. Class of 2025, congratulations. What an honor it is to celebrate this milestone with you all today. Like each of you, I have spent my youth as a perennial student, which means that until this moment, I have exclusively measured the seasons of life in four-year increments. Today is therefore not just the conclusion of our medical school careers, but also the culmination of the many educational incarnations that we have lived through in our quests to become physicians. Those quests would not be possible without the many friends, family, and mentors who have supported us over the years. Each of us has a village to whom thanks are owed, but today I especially want to recognize members of mine, including my roommate, Jorge Zuniga, who I am thrilled to continue training alongside in residency, my mentor, Dr. Harlan Krumholz, who taught me how to ask the questions that matter, my advisors, Dr. D'Amico and Dr. Vanka of the Hinton Society, who kept me grounded and lifted me up, my cousins, Arpit, who's here all the way from India today, Mithil and Rachel, in whose footsteps I'm proud to follow as a physician, my uncle, Bulbul Masa, who sadly passed last fall, but I know is watching from above, and most of all, my parents, whose unwavering belief in my dreams enabled them to become reality. Mom and Dad, while I can't promise I'm done taking standardized tests, I can at least promise that after all of these years as a student, I am finally getting a job. Most of all, thank you to my classmates, the newly minted physicians of the class of 2025. I've always found it fitting that graduation ceremonies are called commencements, marking an ending with a beginning. And standing here today, I can't help but be struck by the difference between our beginnings at HMS and our endings. Some differences are self-evident. For all of us, our white coats are now longer, and for some of us like me, the first of our gray hairs are now in bloom. But other differences go beyond skin deep. 4 years ago, we stepped onto this quad for the first time, under the shadows of these marble buildings, and also the specter of a once-in-a-century pandemic. At orientation, we sat distanced from one another, the faces of our new classmates and professors obscured by masks. When we transitioned to the wards, we received daily emails telling us that the hospital was at capacity disaster. To have come of age as doctors in the midst of such upheaval has undeniably shaped not only us, but the profession which we are about to enter. Amidst this new normal, our generation faces a choice. Will we be the coda for the last era, or the catalyst for a new era? Early in my time at Harvard, a professor quipped to me that, contrary to popular belief, Harvard is not a medical school. Rather, HMS is the idea of what a medical school could be. At the time, I chuckled, thinking that the professor was referring to one of our classmates' favorite ideas, the pass-fail curriculum. But over the years, I have come to appreciate the deeper truth behind that professor's comment. Because the reality is we could have gone anywhere in the country to study medicine, and we would have learned the same things. That the heart has 4 chambers, the body has 206 bones, that the golden question to ask your resident is, when can I go home? But in coming to HMS, we were challenged to learn not just what medicine is, but what medicine could be. And over these past 4 years, our surroundings have fueled that imagination. I mean, walking to work down Longwood Avenue can sometimes feel like the future has arrived ahead of schedule. As students, we scrubbed into surgeries that for our professors used to take weeks-long hospitalizations, but for us could be conducted with same-day discharges. In clinic, we saw the practice of medicine change in real time, with the FDA approving dozens of first-in-class medications every single year of our medical school career. Medicines that were often developed here at Harvard with the support of NIH funding that is today being used as a bargaining chip, selling science and endangering our patients. Nevertheless, the pace of change could often feel so fast that some days I wondered if the talking heads on Twitter were onto something when they talk about AI replacing doctors. But in imagining what medicine is, we have also lived the reality of what it is not. Over the course of clinical training, each of us has felt the disconnect between the breakthroughs in science that we read about and the breakdowns in care that our patients experience. Each of us has felt the tension between being able to order $1 million workups with a click of a button, yet having empty pockets when it comes to addressing the underlying drivers of diseases like homelessness, food insecurity, and poverty. To reimagine our profession, therefore, requires confronting what medicine has become. Because the truth is, we are graduating from medical school at a time when trust in medicine is at an all-time low. We are donning our white coats at a time when the practice of medicine is becoming corporatized. We are entering the wards at a time where diseases once eradicated from our shores risk becoming endemic once more in our patients' lives. And we are becoming healers at a time when life expectancy is regressing in America for the first time in decades. The exigencies that face medicine and society today can admittedly feel overwhelming. But in these moments, I draw solace in remembering that the health of the population starts with the care of the individual. Care that each of us will soon be responsible for, care that each of us has the power to change. Because today, our patients need doctors who understand not only the physiology of the body, but also the body politic. They need master diagnosticians and surgeons, yes, but they also need thoughtful scholars, passionate advocates, and policy leaders. In other words, graduates, they need physicians just like you. Physicians who believe that the oaths they swore are promises they intend to keep. So whether you're moving down the river with me to Fruit Street or across the country to the opposite coast, I hope you'll take this message with you, that the difference between what medicine is and what medicine can be starts with each of us. Congratulations, class of 2025. I am proud to commence the work of a lifetime.